All right. So tell us your name and where you're from.
My name is Bill Harris, and I live in Issaquah, Washington, but I am a Seattle resident, born and raised in Seattle.
And before coming here, how was pain affecting your life?
It had quite an effect, doctor. I've inherited some toenail fungus, and I've had some muscle problems and some problems in my feet. Basically tingling, like a washcloth. You know, when you have a washcloth and you squeeze it, that's the sensation that I had for quite a while. And the first thing I did was go to my regular physician, and Dr. Applebaum says, why don't you, we'll try some non-invasive medication maybe to kind of get rid of some of that tingling, but you're probably going to have to go to a specialist and see somebody or find some place or somewhere that can treat neuropathy. I didn't really know that much about it, but I read up on it, and peripheral neuropathy is probably one of the hardest things to examine, let alone treat. And I think I've hit the home run with Dr. Polzin and his staff, and they're really great to work with, and I'm very happy, and I'm improving.
And so how are you feeling now? How is your life different now?
Before I had problems of my balance. I think that is one of the integral parts of your neuropathy, what you have, and it affects your balance. So that was one of the first things that I noticed. And the second thing was I noticed that I'd be getting some shooting pains, probably from a sciatica nerve problem that recurring once in a while. And so anyway, I decided I was going to try something else and see what that might be. My physician was not a physical therapist person, chiropractor. He didn't really understand the nature of what the illness is. Neuropathy, peripheral neuropathy is a very, very serious affliction that people either inherit through their genes or they pick it up for some deficiency. Anyway, I feel a lot better now. I've enjoyed the treatment. I've seen definite improvements in my balance, and I feel very, very happy, and I'm going to continue to keep active, and with the tools and the training and the therapy that I get here with Dr. Polzin and his staff is beyond relief. It's something that I help myself and help people that have the similar problems.
What's your experience been with the team?
The team is like anything else. It's like a sports team. I played basketball and baseball in high school and college, and the most important thing about team is teamwork. You communicate well with your patients. That's the most important thing, is satisfying your patients' needs and services, and I think they've done a very, very excellent job, and I would recommend them to anybody that has problems, that can't find the right solution. Go see Dr. Polzin's website, and he's at the Bellevue Pain Clinic, so it's easily accessible for most people. And the staff is really, really dedicated, and they encourage open communication, which is something that is very important in this today, in the culture today.
And finally, is there any one or two things that you would say to someone suffering with back pain or peripheral neuropathy?
I would say go see Dr. Polzin and his staff, the Bellevue Pain Institute. They have tremendous physical therapy devices that will help and encourage you to keep active. And if you listen to the listen to the program that they have, each patient has a special program. It's designed to make them feel better. The peripheral neuropathy is something that you can't measure in dollars and cents. You can just hope that the therapy will be positive, and as long as the customer is happy and sees improvement down the line, that's the most important thing.
Thank you.